Prof, always great to chat to you, and thank you so much for coming through. So these figures are looking positive. Is it time for us all to relax?
Hi, Sally, and greetings to the viewers. I think that it's really good to be optimistic about the numbers, and as we have seen all along, the numbers were looking good, and even in terms of mortality and hospitalisation. And I can say that as we sort of move towards the end of the fourth wave, which we expect soon, maybe within the next week or so, then we can actually really be optimistic, but not necessarily to relax. As you correctly said, it does not mean that the pandemic is over. We have to figure out ways of coping with it. We can relax as far as the fourth wave is concerned, but I think going forward, we have to think about how we live with this virus.
Talk to me about your thoughts on rotational learning, which is still underway in most government schools, a sort of one day on, one day off. Do you think it's time to scrap that, though?
Yeah, I think that up until now, rotational learning, it may have served its purpose. We have made headway in terms of dealing with the fourth wave. We need to see how we can start to balance other interests, such as education and catching up with education. And I think it's worth putting our heads together from public health, from epidemiology, from clinical as well, together with education specialists, to think about how best to manage education going forward. We do have to move closer to normalizing the academic year. And I think that given the experience we've had with the fourth wave, we can be a little bit optimistic. We don't know what's going to happen in the future, but I think it's time to intensify education.
Talk to me about vaccination rates. I spoke to Satu a little earlier, and they indicated that some 87% of their teachers have been vaccinated. But we know that across the adult population, all those who are available to be vaccinated, the 12s and up, it's about 45%, somewhat higher in the higher risk groups. Why is it still important to keep pushing the vaccination message when we are so close, it seems, to moving to a quieter endemic phase and perhaps even the tail end of this pandemic?
Yeah, so two things really that are important, I think. One is that in terms of the special professional groups, teachers and healthcare workers, because of the approach that we had in South Africa, we've managed to sort of get to them early. We've managed to push up the rates of coverage for vaccination, which is really good. But we have to acknowledge the fact that we don't have good coverage in terms of vaccination for learners in schools. So for that reason, there's still a little bit of a gap that can have people who are susceptible if they did not have an infection. But the second thing, Sally, that I think it's important, it's really this point about the fact that immunity develops. Like right now, we're coming out of the fourth wave, there's going to be high levels of immunity. Even with the sort of 45%, 50% coverage of vaccination, but we know that immunity also wanes. And the moment the immunity starts to wane, then we start to have a problem of susceptibility whenever new variants develop. So it's important that we keep that in mind, and we have to keep ensuring that immunity levels are high. And if we cannot achieve that through infection, really the one thing that we have is vaccination in order to keep those immunity levels high.
We see reports from the United Kingdom, and we're going to speak to our correspondent a little later this hour, but they have moved isolation down to 5 days. Now, I think South Africa's on 10 days. There was a brief period in December where all the restrictions were basically lifted and then they were put back in place. We're still awaiting complete guidance, but do you think that we're ready? I think we're currently on 10 days. Are we ready to move to a 5-day isolation period?
Yeah, I think that, from the briefing with the minister last week, he made it clear that very soon they will release the updated guidance after their consultations. But I do think that we are ready to reduce isolation. And again, based on the progress that we see so far, it's not something that we can guarantee going into the future, but given the current state, we can do that. I do still think that in as much as we are probably going to family abandon contact tracing and quarantine by government, I still think that it's important that whenever people are infected, they can alert their contacts that they've been infected, and also to support people to self-quarantine if they suspect that they could have been exposed for themselves and for people around. I think that message should not be lost, even though I agree that we should not be spending huge amounts of government resources dealing with issues of contact tracing and quarantine. But I think that we are closer, and we expect to see that updated policy soon.
Thank you so much. Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.